Doctor, we just want someone who can spearhead to see that we have enough grants and more equipment of our hospital. That's what these people are proposing. And they were proposing the name.
Don't give us proposals because we do not control our budgets.
CVA basically stands for Citizen Voice and Action. This is an approach that was introduced by World Vision, where service providers are brought together with the service consumers. And these two parties come together to look at the quality of the services and then together look at how best they can make the services conducive. So the service user will come and air out their challenges in as far as the service is concerned. And then the service provider will listen to them, and together as the service user and the provider will come together to find a solution on how best they will improve on the services for the betterment. We invited boys, the young ones. Those are some of them who fall under the pediatric section. We invited girls, young ones, and the teens. We invited men. We invited women. And then we invited the technical people. And we have put them into different groups. And into the groups, they have come out to assess the standards or the quality of the services they receive at the hospital. And then also measure the standards, that's basically the amount of things that are at the hospital. In that we mean, if the national standards say such a hospital should have 50 doctors, so today it has been a mandate of the people using the hospital to come and know, is it the right number that is here? And if it's not the right number that is here, what can the people and the management of the hospital do to ensure that they have the right number and they have the right services?
I've learned that health workers will be well trained before they start treating patients. Also, health workers will give patients drugs which are prescribed, and health workers will give patients drugs which are not yet expired. And health workers will also, the government will also provide drugs which are quality, which are not expired.
My thanks go back to World Vision for bringing such an occasion, because it's so vital and it's so important for doctors to know that as patients we do have complaints. They do treat us, but they don't satisfy us to the percentage that we do want. There are some patients that require emergency or urgent assistance, but you find when you come, you're supposed to be treated. The doctors are in their own mood. They can't treat you. They take their jobs for granted. They want us to plead for them, and yet they're supposed to extend the help to us. Why not to janjaba?